Welcome back. How to reduce the chance of stroke and what are the symptoms that the patient feels before it occurs. First, taking aspirin is no longer appropriate to prevent clots, unless your doctor thinks you should take this liquid medicine. Second, blood to flow in the blood vessels has a viscosity. We must reduce this viscosity and keep blood flowing quickly. And keeping the vascular wall smooth from the inside to prevent friction of blood cells, which reduces their speed and the occurrence of clots. 1. Because of its low viscosity, water is one of the best drinks that facilitate the movement of blood cells in the blood vessels. Therefore, you should drink 8 glasses of water and liquids a day. On hot summer days, due to frequent sweating, you should increase the number of glasses of water to replace the lost fluids from your body. 2. Lack of movement and frequent sitting cause a lack of muscle contraction. That's because when muscles contract, it pushes blood through your arteries and veins all over your body. Therefore, you should move and walk to move blood from the blood vessels to the heart and brain, and speeding up the flow of blood in your body. So set aside a fixed time in the day to practice walking exercise for 1 hour a day. Because physical activity is one of the best habits that helps stimulate blood circulation and reduce the risk of stroke. 3. Stop smoking immediately. A specialized study has confirmed that smoking causes inflammation in the vascular wall and deposits of fat cells. Smoking also causes the chemicals contained in smoke to be deposited under the arterial wall, causing blockage. This leads to the cessation of blood flow in the arteries, thus hindering the movement of blood in the blood vessels. 4. You should adjust your blood sugar levels. This reduces the chance of vasculitis and atherosclerosis. Therefore, you should reduce your intake of sugars, starches and soft drinks. Now we will talk about 5 symptoms that appear in a patient 6 hours before a stroke occurs. And what should he do if these symptoms occur in order not to get paraplegia? The brain has a complex network of blood vessels. Through it, blood reaches the brain. It takes oxygen and glucose from the blood, which is the brain's food. This makes the brain control the body and do its job perfectly. A clot occurs when a specific part of an artery that feeds a specific area in the brain begins to contract. Later, fatty lumps or some clotted blood come in and close this place in the artery. The blood gradually decreases until it finally stops passing through the fine artery. And in this case, the part of the brain that feeds and depends on this artery is affected. This lasts 4 to 6 hours. During this period, the patient will experience 5 symptoms. 1. Numbness in the middle of the face along with numbness of the hand and leg. Numbness occurs in the right or left part of the body. 2. Raise your hands up. The hand that suffers from numbness will fall down immediately. This indicates that there is no control between the brain and the arm. This is happening but not because of cartilage, because it occurs without pain in the hand. 3. It is difficult to close the eye on the side of numbness well. In addition to blurred vision, this is accompanied by a curvature in the mouth when the patient smiles. 4. Headaches and numbness in the head, either in whole or in part. 5. Lack of concentration. You will find the affected person having difficulty speaking and unable to concentrate. All 5 symptoms indicate that a stroke will occur soon. The best solution is to take the patient who has these symptoms to the hospital immediately. Doctors will examine these symptoms and give the patient medication to dissolve the clot and enable blood to pass through the closed artery in the brain, and access to the part of the brain that feeds from this artery. The sooner the patient gets treatment, the risk of complications in the patient's body is reduced. Damage that is limited to weakness in the middle of the body will be easy to treat through physical therapy sessions, while the patient will need a longer period of physical therapy in the event of a delay in taking the treatment, or after removing the clot site through surgical intervention. Another type of stroke is more serious and causes the patient to faint, where bleeding occurs in an artery because the artery wall is very thin and weak. With high blood pressure, blood bursts out of the artery and clots in the brain. In this case, Doctors will give the patient drugs to stop bleeding and other drugs to remove blood from the brain and surgical intervention. The patient will suffer from severe difficulty in the movement of the arms and fingers and a longer period of physical therapy from the first case. We will talk soon about the best healthy foods that dissolve clots and what are the most important health practices to prevent their occurrence. We welcome all new subscribers to the channel.
Thank you for watching. Subscribe to like channel to receive all new news.